psychologist and yoga teacher from initially maybe some 10 to 15 minutes it will take for me to adjust myself with your energies. It is my initial time to de-stress myself and get attuned with this new energy. So initial 15 minutes or 20 minutes it will not be so much interesting, or maybe something we will be talking very casually. Even though slides are there, but I will not be going through the routines of the slides, because I will use this as a cue or clues for me to speak something. So as thank you for Madam to introduce to such a intellectual students. It will be very, very interesting for you to go through without being biased anywhere. So keep your scientific mind, questioning mind open. At the end you can ask a number of questions also, no problem. I consider Buddha as one of the scientists. So most of modern medical people or scientists or psychologists or psychiatrists doesn't accept anything which is not proven. You know? I wish you to have this kind of mindset. Even if whatever I share with you, you can take it but don't believe it. Unless you are convinced with your own mind, your own intellect, your own understanding, and then you apply. So that this idea you should have throughout your life, anywhere, anytime. So have your intelligence, questioning mind intact, and also use your intuition. Have you studied of Carl Jung?
Yes.
So most of the time, whatever I focus, it is based on his work, and another doctor by name Dr. Herbert Benson. You can note on these two names. If you study these two, I think you can get most of the information about alternative medical system. Dr. Carl Jung and Dr. Herbert Benson. Herbert Benson was is an Harvard medical scientist. Was first did a research on alternative medical system in Tibetan monks, and he found that something concept called as the relaxation response that we experience, and then we can go through. Will you be able to listen without mic or with mic?
Without.
This is your Carl Jung. He talks of combining your intelligence and intuition together. So that's how you have your mind at this moment attuned for this. In most of your learnings or counseling practices, you use pause or silence also as a tool to communicate. Do you? You are learning anything about that? You will be. So just casually start by showing you the small picture of evolution of a human, from an animal being to a human, from a human to a divine human being, and from the divine to the God himself. Somewhere in Bible, Jesus says two words. Says that God is my Father and I am God also. So it means that the evolution from a human, basic human, animalistic human to a higher divine, where you perceive those higher energies, you will become just as a tool or an instrument where you perceive that higher energies and you share it. To understand in a psychological context, you know about the conscious mind, subconscious mind. Conscious mind constitutes about some 10%, 8 to 10% of your entire mind, and more than 90% is subconscious mind. If there is some method where you are able to tap the subconscious energies consciously, that can be called under what you want to practice alternative healing is that. So whenever you sleep, is you are surrendering your conscious mind to the nature without your awareness. You agree with me? I'll repeat this. Whenever you sleep off. You consciously let go of your conscious mind or intellectual mind, thinking mind, and you surrender yourself to the nature. Then only nature comes in. Then the next day, if you wake up, you feel fresh. It's because you have allowed the nature to come through you. So that healing has happened because you let it, and you are not thinking much. You are letting go. So this is a reverse of what we usually do as a scientist. Scientists, we use our senses and to the outside world, but this science is inside. It's the inner world. You know, if somebody claims to be having high energies or enlightened or having some other extra parapsychological phenomena, it simply means that they have gone from the conscious mind consciously into the subconscious and then touching the cosmic unconsciousness or collective unconsciousness. Then they receive that energy, whatever it is, spiritual energy or as a scientist. Most of discoveries have been made in sleep. When they are sleeping, thinking too much of something, and they sleep off. Suddenly, benzene ring. Who is the scientist? Benzene ring, I don't remember now, but he got that there are 6 snakes. One catching another's tail. So then he found that benzene ring. So similarly, there is some energy beyond our logical understanding that we call it as, and you can call it as in prana, or you can call it as bioenergy, or you can call it as a spirit. In Islam, they call it as a ruh, R-O-H. It's a soul energy. So psychology has been evolved from the past 400 to 500 years, you can say that. But spirit, this yoga, there are so many number of examples where it is shown that mind can be transcended and worked on, and then spirit can be grabbed by multiple methods. We will not go into much of those details. But when you, in your perspective, being a psychologist, when you encounter these kind of patients, where you say, sir, I have done this particular shamanism, some practice, then I got relieved. I got to know some person who healed me, and then so you no need to believe directly, but you no need to deny also. So you need to be in the middle as a Buddha. Don't go to an extreme scientist, logical mind. Don't go to extreme belief. So be in the middle. So this mind you should have throughout, wherever you encounter anything new. Okay. So let it be a two-way, so that I'll understand what's happening. Yeah. Two-way in the sense you communicate non-verbally now. Your eyes with your so your mind, body, spirit. These three are essential for you to treat. So I am talking in terms of your career wise or your understanding of education wise. So body, mind and spirit. So these three. If these three are balanced, then we say that there can be a balance at the level of body, at the level of mind, at the level of spirit. And any derangement of this can cause some diseases or some conditions. There are most of modern days, you cannot exactly call it as a disease, but these are conditions like insomnia, anxiety, general anxiety disorder. If it is worst and then it's mixed or something else, will categorize into diseases. But if it is in the transition between a normal and abnormal, it is a condition. So you need to be aware that this mind, body, spirit healing practices also sometimes contribute for recovery of the patient. So being a psychologist, you are qualified enough to probe them in any way you're being designed to do it. But also you can use alternative healing methods by yourself. So that will be an added advantage if you, rather than just sending them to some prayers or some parents, if you do it by yourself, it gives an holistic approach to that particular person's mind and body. Do you agree? So how are you? Where are you and how are you? You can just go through, no need to answer, we will speak at last.
The light is bad. I thought I see.
Simple chart representing all the emotions. I am using just to create a curiosity in you. So what topic we are going to talk now is, it comes under a broader title called as Complementary and Alternative Medicines, CAM. You know, any time when you type this on your Google, you get to know this information. Complementary and Alternative Medicines, CAM. So any practices which you use for preventing, treating or promoting health or well-being, which is away from a routine conventional medicines, can come under complementary and alternative medicine. So out of that we are discussing 3 or 4: acupuncture, yoga, meditation, Reiki and pranic healing. So few I give a glimpse. I don't want to go in a very technical terms and make you get bored. So I'll just give a glimpse where a spark in your mind makes you read more about it. That's my motto at this point of time. So those complementary and alternative medicines can be broadly categorized into these 4: energy medicine, biologically based practices, mind-body medicine, and manipulative and body-based practices. So this picture is derived from National Institute of Health, USA. So they have started an integrated approach called as NCCAM, National Council for Complementary and Alternative Medicine, where biggest funding agency for all these alternative therapies are from NCCAM. So authentic source you can get from NCCAM websites, www.nccam.org, National Council for Complementary and Alternative Medicine.org. For your information, this NCCAM is a branch of National Institute of Health, USA. National Institute of Health considered to be the highest medical authority in America. So by seeing tremendous interest, so this is a significant in your statistical information, tremendous interest in people who are going to a physician. More than 39 to 42% of regular physicians visiting people are trying one or other alternative modalities of treatment. See this statistical information. More than 39 to 42% of people who are usually go to a medical doctor or a psychologist or a psychiatrist are trying one or other modalities of treatment. Out of that, top 10 modalities of treatment, these 3 will come, these 4 will come. Yoga, Ayurveda is one of the top 6 or 8, I think. Acupuncture and manipulative therapies comes first and second. So statistically, people's mind is in tune to try something new to heal themselves. Is it right or wrong? As common, we say, I'm having headache for so many years, I'm taking medicines. If I try some other herbal medications which will help me, why can't I go for it? Because it's safe, that we feel that. It's safe and why can't I try? Let me see. So this mindset we have. We should encourage, being a psychologist, we should encourage that, but with the thought that it should be safe and should not harm first. It's working, not working, secondary. It should be safe enough. So under this broad category, these four, I'll just quickly show you. You find your acupuncture and yoga into few categories. 1, 2, you can remember those color codes. So this is the slide I'll be sharing with you. So one crystal healing is here. It comes under your Reiki and pranic healing. I brought a small crystal for you to show. Traditional Chinese medicine, traditional herbal medicine is a part of acupuncture is a part of traditional herbal medicine. So it comes under biologically based practices. ACM. Ayurveda comes under biologically based therapies. Homeopathy also similar. Reiki comes under energy based. Your counseling comes under mind body. Art therapy, autogenic training, you can add up. Aromatherapy can be both. Whether it is broadly categorized into manipulative body-based therapies, it can be both mind-body intervention also, energy healing also. So there is no very tight, watertight compartment to say that it is only work here. So it can be both. So music therapy, mind-body. Natural therapy, energy. So out of these many, they have mentioned common practice and rarer we don't go for it. Spiritual counseling also comes. So being a valid counselor, qualified counselor, you can adopt spiritual counseling also. There are some beliefs based on the belief system of the people. If somebody is a Buddhist, somebody is a Christian, somebody is a Muslim, somebody is a Hindu. Based on their belief system, you can use those belief system as a tool. Either to distract them, you use a dissociation therapies, whatever you practice, dissociation therapies, distract them and make their mind under control, or to use something as a one-pointed focus or focusing techniques. You have seen people doing japa or rosary, Muslim people doing those things. That I simply call it as one-pointed focus techniques. You make their patient's mind to focus on something one, based on their belief. If belief is there, their focusing will be far better. You are using those belief as a tool to make them focus more. So you should be intelligent enough to incorporate. So that should be the integration idea in you. You should start now itself. So integration of things which are little beyond your logical, what you practice in clinical psychology. It is a little beyond, but still you need to know it and incorporate it so that your practice is completely holistic or integrated. So that comes under integrative psychology. So with this little introduction, I'll not make things boring. You're okay with this for now? So you're able to categorize. So this is one evidence-based research protocol I use, where our work comes, being a medical doctor, psychologist. It is an integrated work. We cannot work single-handedly. Everything I cannot do alone. I can give injection, I can give medicines. Understand? Or I can teach or do some yoga. But we should be able to integrate things. So this is a broad concept I use. Body, mind and spirit. These three things you can see at the center. Surrounded by family, medical system on one side, lifestyle on the other side, work on the other side. So psychologists, we usually categorize therapy into two broad healthcare domains. So this is important for you. First one is biomedical system of healthcare. You can note down. There are two healthcare models. Biomedical healthcare model. Second one is bio, psycho, socio, spiritual healthcare model. think you might have studied this. So under the second category, which is practiced less, most of allopathy hospitals or Ayurveda hospitals or homeopathy hospitals they exclusively concentrate on their field, nothing else. If you have some acidity, you go to a doctor, they'll say your gastric stomach acidity is more, there might be some gastritis or esophagitis. Take this antacids. Antacid is, so acidity is more and you are giving antacid. It makes logic. But how long? So there is something trigger happening at the back of this person's mind, which is stressor. You can take it as a stressor. That stressor is making him think and worry. That worry is increasing his adrenaline and noradrenaline levels from the adrenal glands. And those indirectly increasing your muscle tension or increasing in hydrochloric acid or increasing in hyperventilation. So ultimately, if the stressor is for long, many months, 2 years, it will end up in anxiety, sleeplessness, hyper alert state, gastritis, muscle tension, neck pain, back pain. How many of you have neck pain? Headache? So work stress, if you see your work stress is more, study stress is more, you have headache. It is a simple incoordination of your mind. So there is again modern medical people now they are acknowledging that mind can also influence the body. So it comes under mind-body therapies or mind-body medicine. They have started a separate field of medicine where you see interaction of mind and interaction of the body. And how mind-body related diseases can be prevented by using these alternative modalities. Okay. You're okay with this till this point?
Yes.
Medically, I want to add some two little informations. Our body is considered to be having two varieties of nervous systems. One comes under voluntary nervous system, another one involuntary nervous system. In that involuntary nervous system, again divided into two categories. Involuntary you can call it as an autonomic nervous system. Two categories, sympathetic and parasympathetic. You are aware of it?
Yes.
So sympathetic is nothing but fight or flight response. Parasympathetic is rest and digest. Your body will be prepared in a such a way either to fight with a situation that can be psychological, that can be physical, that can be just perception itself. You seeing a rope as a snake can be perception, even though it is not a reality, but you still perceive and your bodily response will be altered. It will be stress, fight or flight response. So simply saying there is an imbalance of sympathetic and parasympathetic nervous system. Too much of sympathetic activity, too much of multitasking. So one part of your autonomic nervous system is working too much. So there is an imbalance set in the body. So there biologically that is a point where it considers as a pathological part which starts. So too much of sympathetic, less of parasympathetic. So with this concept and the concept of autonomic nervous system, what we need to know is whatever practices we are going to learn or we are going to know a little bit, we are going to incorporate to enhance parasympathetic activity. You are okay with this?
Yes.
To enhance parasympathetic activity and to reduce too much of sympathetic overtone. That is medically speaking, that is one context. Psychologically speaking, the spirit, body and mind should be incorporated in one alignment. So this is a bit, very small little introduction. I'll give a break of 1 minute just to rearrange yourself. So whoever are interested to get pricked, because your attention span is not more than 15 to 20. So every 15 to 20 I break down, cut down, make you relaxed and then go ahead.
So can we start with the demonstration of nutrition?
Can. It depends on that. It usually takes some 20 minutes to feel energy. You know? And by clicking you will be more alert. You will see clear more. So I'll give you a crystal. Just go through it and feel, touch and feel.